looking to the posterior wall of the middle ear from the posterior side. Here clearly you can see the facial nerve running towards the posterior wall from the medial wall, exiting to the foramen, and which runs vertically downwards. It gives a second branch over here. This branch supplies the stapedius muscle. Can you see a muscle over here? This small muscle which form a pyramidalis. This muscle is stapedius muscle, and this nerve supplies the stapedius muscle. Then the facial nerve descends further downwards and exits to a stylomastoid foramen. Just before the exit, that is 6 mm above the exit, it gives one more branch called as chorda tympani. This chorda tympani branch ascends upwards again, enters the posterior canaliculus to enter into the middle ear cavity. And this opening, whatever you are seeing here, this is the opening of the mastoid antrum into the middle ear. And this small opening, this small fossa, is for the handle of the short process of the incus. Here you can see a behind cavity. This is mastoid antrum. This mastoid antrum opens into the middle ear cavity by a orange color opening you are seeing there. And there runs the facial nerve in between the mastoid antrum and the posterior wall of the middle ear. Posterior wall of the middle ear is from the anterior side. You can see the facial nerve exiting out to the posterior wall through a foramen. Just below the exiting of the facial nerve, there is a extension called as pyramidalis, upon which the stapedius muscle is attached, and the nerve to the stapedius is also there. The green one you are seeing is a tendon of the stapedius, which is getting attached to the oval window. And just posterior, just superior to the opening of the facial nerve, you can find the orange one, that is opening of the mastoid antrum into the middle ear cavity. And there is one more opening here. That opening is for the short process of the incus. And the anterior and the lateralmost opening over there, that is called as posterior canaliculus, which gives the entry of the chorda tympani nerve into the middle ear.